Okay, excellent. So I will go ahead and move this into presentation mode. Okay, excellent. Well, good evening, everybody. I know for those of us here in Northern California, it is dark outside. So welcome to our session on anxiety and depression with teens. I'd like to introduce the MindWise project and our team, and then we'll get going. So for MindWise, our mission is to improve youth mental health and well-being by promoting awareness and reducing stigma around anxiety, depression, and eating disorders to enable early detection and intervention of these conditions. And for today's session, I'm just going to start with a few simple housekeeping items. So if you, whoever's not speaking, if you wouldn't mind just muting your audio, that would be great. And everybody's already done that, so thank you. If you want to stay anonymous, two simple ways to do that is just to remove your name from your Zoom window. It's totally your choice if you want to keep video on or off. So if you want anonymity, those are a couple of options. And then we will be recording the presentation, just the presentation portion of it at the end. We will have a Q&A section, and I'll make sure to turn off the recording for the Q&A session so that folks can be open and not have to be recorded. And for questions, we have a very awesome clinical team who has joined us today and will be doing the presentation. So if you have questions for them, if you could just write them in the chat, that way one of our team members will be kind of capturing them and we will address them at the end. So those are just some of the items. We'll start with some introductions. We will focus this is part one of a two-part series. So for this meeting, we will focus on anxiety and depression in teens. We'll talk about what is it, what to look for as parents primarily, what to do, when to intervene, how to intervene, all of those things. And we will share some resources that might be useful to parents. And then for MindWise, we are a nonprofit, grassroots, community-based organization. And we're a fairly fresh new organization. We have a community page and a community set up in Facebook, so you can feel free to join us there. And we'll be sharing resources and having more support there from time to time. So with that, we will go ahead and get going. We'll start with some introductions for the leadership team for MindWise, and then I'll hand it over to Dr. David Lin and his team. So my name is Afsana Akhtar. I'm a part of this MIT CNC because I am an alum. I live in the Bay Area now. I was engineering undergrad of 98, master's of 99. I've worked in digital health for 18 years. Prior to that, I did work in tech. And I've worked specifically in mental health for a few years now. I'm not a clinician. But one of the things that inspired me to start MindWise was that even as a person fairly knowledgeable about healthcare and mental health, when it came to family members, I wasn't particularly savvy about identifying and intervening and making all the right decisions at the right times. And I thought, if I'm struggling, there are probably many other parents who are going through the same. And so for that reason, I grouped up with some people and we started MindWise here. And our goal is to really create awareness and support for parents, maybe also kind of teachers to help families around this topic. I'd like to welcome Sheena and Leanne to introduce themselves as well.
Thank you, Afsana. Likewise, I have a clinical background, but I'm currently a performance and meditation coach. And this is also an area that I've been very interested in for a long time, as many of my clients and their children experience a lot of these conditions. And we are hoping to provide as much support and awareness around the issue and engage with as many people as possible and get it out there that we are available. And like Afsana mentioned, we have a Facebook community and we'd like to provide ongoing support as much as we can. So hopefully we can continue to do this as a group and together. Leanne?
Hi, my name is Lan Pham. I have a biology degree, and I used to work in biotech dealing with cancer research. And I switched role after what do you call it, a car accident that taught me how important mental health is. So now I'm getting my PhD in mental health, and my dissertation is on how forgiveness and improve mental health and decrease anxiety, depression, and stress. So it's fall right into this presentation.
Great. Well, thank you both for all the work both Leanne and Sheena have done in preparing for this, and all the work that we're going to do moving forward. We also have, as part of the organization, youth ambassadors. So these are folks, young people, teenagers, or people who are recently teenagers that can really provide the teen perspective. So Vaishnavi is our first, and we hope to have more. She's actually in the group today. And then Shalini Verma is another parent. So we also hope to have parent ambassadors that can help, help us have more reach in the community, as well as clinical advisors such as Dr. David Lin and others who can really provide the clinical expertise in helping the community understand these conditions. So with that, I'd love to hand it over to David. So I'm going to stop sharing, but keep recording. And then, actually, I'm sorry, I have some more slides. So David, I will keep going. And then if it's okay, when I hand it over to you, you can introduce the team. So I will continue here. So yes, I'd actually like to start by also thanking our contributing sponsors. And our first one is a company called Overcome. So if you could join and just share a little bit about Overcome, that would be great, Adam.
Yeah, awesome. Thanks, Afsana. Hi, everyone. My name's Adam Hutchinson. I'm the founder of Overcome. We're a startup here in New Zealand. I'm also the father of a 13-year-old son as well. And apologies for the noise in the background. There is some construction going on here. But our goal is around making treatment for different anxiety disorders easier to access using virtual reality, and specifically on the smartphone. So basically, if someone comes to us with some social anxiety or a particular phobia, we can actually deliver a clinically proven program to them via their smartphone. We've completed 2 clinical trials with the University of Otago now. The first clinical trial showed that on average there was a 75% reduction in the severity of a phobia after 6 weeks. The second clinical trial, which we've just wrapped up, is around social anxiety, is to be published next month, and we've seen a really significant reduction in that. So again, solving the accessibility issue by targeting the smartphone using virtual reality to do that. So thanks, Afsana, again, and really, really excited to be involved.
Great. Well, thank you for joining us. And Adam has very kindly offered MindWise participants. So folks in this forum, if you want to subscribe to the product, there's a 25% off promotional code for that. And then also, David, would you like to introduce Peninsula Wellness in your organization now?
Sure, thanks. And it's really an honor and pleasure to be here with you all. So Peninsula Wellness Psychological Corporation is my group practice here in Burlingame, and I'm very fortunate to have Jessica Tang and Selena Chan with me. Both of them are licensed marriage and family therapists, and we'll do introductions in a little bit. I've actually been practicing there since 2007, and through that time period, I've seen just a wide array of clients that have come through, and just feel really blessed to be in and part of the community. And so we're here to just expand our community reach to the Northern California area, and specifically the MIT alums. So thanks for, again, letting us be here to be with you.
Great, thank you. And we are a strong group. There are 15,000 alums in the area, and the group MIT CNC has a few thousand that are signed up members. So it's one of the largest groups, alumni groups in the US for the institution. So I'll dive in and share a little stats, share some stats, and I think it really points to why this is such an important topic and a discussion to have. So really, anxiety and depression among teens and children overall has really grown in the past few years, pre-COVID, during COVID, and it's continued beyond COVID as well. So just some very specific stats here. So from 2016 to 19, which was pre-COVID, anxiety increased by 20% and depression increased by 24%. So both increased quite a bit, right? And for children specifically, about 9% of children were diagnosed with anxiety, 4% of children were diagnosed with depression. And then if we look to teens, those numbers are higher. So for younger teens, such as at the age of 13, about 8% of them have a diagnosable anxiety disorder. But by the time teens get to 18, that number almost doubles. So 15% of teens by the age of 18 have symptoms of clinical anxiety. So the numbers are high, and pre-COVID as well as beyond. And then if we look at depression, 15% of youth ages 12 to 17 report suffering from at least one major depressive disorder in the past year. And we know that if it goes untreated, they actually carry it into adulthood. It doesn't just go away as they grow up. And depression is tied a lot to suicide, unfortunately, and nearly 1 in 5, which is 20% of high school students, had seriously considered attempting suicide during the previous year. And then 18% actually made a suicide plan, and 10% attempted suicide. So I know we hear about this a lot in the Bay Area, and I think nationally it's a big issue as well. And the literature points to many correlations, many reasons: social media use, academic stress, the various kinds of impacts of COVID, some of which are still lingering, overuse of screens, inadequate sleep, and there's just a lot of many different types of data. Here too, on the left, you see these bar charts where the bottom 3 show the use of social media among teens going up year over year quite significantly, and that correlates with the trend in teenagers reporting persistent sadness, hopelessness, etc. So I think intuitively we can understand why, but the data is also starting to show these strong correlations. And why is it so confusing? I think we throw around words like anxiety and depression, but really, when we really dig into it, there are so many different types of anxiety, which is something I've learned from working in the space, different types of depression. So it's really hard, I think, for parents and anyone really to understand, is it anxiety? Is it depression? What type of anxiety? What type of depression? Because while both are treatable, how they're treated and how the intervention happens can vary. And it's true that parents often don't know where to go when they have questions about whether their kid even has anxiety or depression and if they need support. They often don't know when to intervene, when is too early, when is late. And it's really important because these conditions can escalate very rapidly. So that's why obviously we're here and we're having this discussion. And so with that, I am now going to hand it over to David. So let me first stop sharing, and then I will hand it over to our esteemed team of clinicians to help demystify a lot of that.
Oh. Okay. Let me just make sure I'm unmuted. So I think everyone can hear me.
Yes.
It's really good to be here with everyone. Let me go into slideshow mode. Okay. So it's really good to be here with all of you. And like I said, for Peninsula Wellness to be in part of the community is exactly where we want to be. So when Afsana said, hey, would you like to come and talk to our MIT alum in the NorCal area, I was like, yes, because this is part of our mission and part of our passion is to make sure that we have the chances to speak about mental health, because frankly, it's confusing. It's like mystifying, like what is mental health and what is are all these diagnoses, and let alone accessing care. Like accessing care is a crazy thing in general. But bringing it back, like, so it's like, wait, why are you here? Or rather, why am I here? It's mainly because we're all here because we're interested about the topic of depression and anxiety as it relates to maybe our children, ourselves, maybe it's our grandchildren, depending on where you are in your stage of life. But we're here together. We're here to learn, and learning is a huge part of the preventive side of behavioral health that we need to continue to learn and talk about. So before I go any further, I just want to take a moment to introduce ourselves. So I'm Dave Lin. I'm a clinical psychologist by training, and I've been in the field probably 25 years now. Prior to my practice that I'm in, I was actually the chief of the medical psychiatry services over at the San Mateo County Hospital for about 14 years. And then I left there to, again, focus on my group practice, but actually also do consulting on technology ventures that are integrating behavioral health and technology, because frankly, having a clinician at the team is, I think, extremely important. So I want to put myself out there. And more recently, I was able to participate at a higher level of working on policy and advocacy as the president for the California Psychological Association. And that was a great chance to really flex different muscles of my my role as a psychologist. And I'm just glad to be here with you all. So I'm going to turn over to ask if Jessica and then Selena, if you guys could introduce yourselves as well.
Yeah, definitely. Well, hi, everyone. And my name is Jessica. I'm a licensed marriage family therapist. And it's a great pleasure, really, after seeing some of you on the screen. It's a great pleasure to be here and to definitely share and learn and support each other on how we can better love and support our younger generation. I'm a mom of two amazing girls. One is 19. She's currently attending college. And my younger one is attending as a junior, attending high school, 16 years old. And they both have been and still continue to struggle with mental health issues. So as you can see, our topics today here on depression and anxiety definitely has a special meaning for me. Professionally, I work with children, teens, young adults, as well as parents over the years in school, home, and community settings. So I hope to, be that comforting, reassuring, and the guiding presence for them in their struggles against mental health challenges. And I'll turn it over to Selena.
Hi, everyone. My name is Selena, and I, too, am a licensed marriage family therapist. So by profession, actually started as a recreation therapist, and I crossed paths with Dave the same time he was at San Mateo Medical Center. So I, too, was at San Mateo Medical Center as a recreation therapist for 14 years. after that, I kind of wanted something deeper. And so after San Mateo Medical Center, I went overseas to China and did some community development work to basically understand people's behaviors in a broader international, and for me, more like reconnecting with kind of the home country kind of sense. And I was there to help promote emotional wellness within the elderly as well as kids, working in community center and senior center. And I came back and went to grad school to continue my journey to learn more about behaviors, and went to Palo Alto University. And after that, I got a chance to work in community mental health clinics as well as school-based. And currently, I am back as a behavioral health clinician working with the elderly. So I too am so excited to be here to have this opportunity to share with you about emotional well-being, especially in youth, dealing with anxiety and depression, because these are two very common diagnoses that we are seeing in all settings, school-based, in family, and yeah. So thank you for this opportunity to be here to connect with all of you.
Thanks, Selena. Thanks, Jessica. We're gonna move along here, and today, like the topic is, we mentioned depression, anxiety. We're going to talk about 11 things that you may or may not know about anxiety and depression. And some of it's pretty common knowledge, but some of it might be kind of interesting to hear and know. And I think what we're sharing with you is a lot of it is research-based, but a lot of it is also just experiential about what we've seen over the last decade of the work that we've been doing. And then I'm going to present to you 3 different tools or techniques that you can use with your child or teen, and then 2 different ways that we can provide support mind-wise and Peninsula Wellness. So the way we're going to structure is we're going to tackle depression first and kind of focus in on that, and then we're going to transition to anxiety, and then we'll get to the tools and additional support down below. So I'm going to pass this off to Jessica.
Great. Thank you, Dave. So let's, can you help me see the next slide, please? So here, so the first question we're going to ask is, what are the top 3 problems teens face today? And I'm going to ask for some participations from all of you. So looking at this list, if you can kind of go through and kind of think about what you believe is the top 3 problems, and feel free to please type it in the chat, or are we still having the poll, or?
I think we might just type it in the chat.
Type it in the chat. Okay, so please type in the chat your top 3 choices from this list of what you think is the top 3 problems teens face today. So I'll give it a minute or so, and let's see. Anxiety, depression, bullying, poverty. Okay, very good. Anxiety, addiction, yes. Alcohol, yes. Anxiety, drug use, and bullying. Yeah, you guys are really right on. I see a lot of you guys have typed in anxiety, depression, drug use, alcohol, and there's bullying, definitely. And exactly, that is, by research support, that is the top 3. Is the anxiety, depression, that's 1, and bullying, that's the 2nd, and drug addiction is the 3rd. And that is the top 3 problems teens face today. And I'm going to just, cover a little bit on each one of them. So with anxiety, like Afsana talked about earlier, and it's been pretty high among teens. Even prior to the pandemic, we were already seeing the cases of anxiety and depression on the rise, especially among teenagers. Now, when the pandemic hit, things went from bad to worse. As we all have experienced social isolation, and if we can remember a few years back, fears of contracting the virus and losing loved ones, of many people have experienced that tragic. And also for kids not able to go to school, for adults not able to go to work, right? And not able to meet up with friends. And especially for our children, teenagers, that's important. And then also missing out on graduations, really unfortunately for some of them. And the social unrest that we see on the news. Personally, I think our kids went through all of this. And also one of my daughter actually she had to go through a drive-through graduation. And so I thought that was very creative of the school to do that. But definitely they're losing out on what they expected of usual graduation. So all these drastic changes have caused great fears, anxieties, and emotional distress in all of us, and definitely for them, for the young people as well. Now, the next one on bullying. So bullying can be very obvious, but it can also be invisible. Why is that? So children and teens, they may tell you what happened at school or when they're being bullied, but most of the time they are probably too embarrassed or too afraid to say anything to you as parents until they themselves start developing these avoidance behaviors, which can eventually lead to depression or anxiety. So a lot of the times, the questions that you probably want to know or to ask is, do they know when they're being bullied? And what does that look like, right? And having those conversations. Example, like on social media, which we will talk about later too. There's the social exclusion, right? Now you can see the group of friends that you thought you were part of, and they have gone to movies, they have gone to trips without including you, and they post pictures of their outings. And so that's, these kind of social exclusion, and that really hurts our teens. Also questions like, do they know who to talk to when they're in school experiencing bullying? There are different types of bullying, which you can learn as parents, do research and learn and talk, sit down and really have these kind of talks with your children about them. Different types of bullying, like physical bullying, right? That's more obvious ones. But the emotional ones, the social ones, the cyberbullying, that's not as visible. And there's definitely the sexual ones as well. So the last one I'm going to touch on is the drug addiction, which a lot of you guys picked. And that's right on what you picked. It can be a trigger. Drug addictions can be a trigger for depression and anxiety, but as well as it can be the end result from anxiety, depression when it's left untreated. Okay, and it will be good for the parents to know what are these common drugs that our children are being exposed to out there. Do they know what effects these drugs have on their health? A lot of them don't know, and so therefore they don't know how to protect themselves, right? And then one thing that parents often overlook, and our kids overlook it, is caffeine. Nowadays, our teens and our young people, they're consuming high amounts of caffeine. Maybe some of us are in that line too. Why do they do that? Well, under the school pressure, the academic pressure, they need to stay awake. They take caffeine to help them focus, and sometimes just to be cool, right? Following the trend, drinking Starbucks or having a cup in your hand when you go to school. And some other common substance that a lot of our, the people get referred to our service, to our private practice, teens, struggles with is alcohol, marijuana, tobacco is very common, vaping, and hallucinogens, and the biggest one is fentanyl. Even in schools, overdose fentanyl, it's very common, and you hear a lot. And one of my daughters, a couple years back, one of her classmates actually died from overdose. And so these, some of the questions that you might want to ask is, do they know how to say no in social settings? How to say no, but still can be accepted socially, right? So our kids are actually under a lot of pressure to say yes. And then what are some strategies that you can talk to your kids and to come up with when they go to parties, that they can still kind of be protected? So that's what I was gonna touch upon that for that slide. And can we go to the next slide, Dave, please? So the next question here that you might want to ask is, what is the mean age for the onset of depression? And again, I would like some participation from you. If you can type in the chat, just kind of off the top of your head, what you think is the onset age. 15. Okay, very good. Anyone else? 14, 25. Yeah, wow, 10. Yeah, definitely. I'll give it a few more seconds and see if anyone else wanted to type in and participate. So I see 14, 25, 15, 10. So yeah, so the onset, as you can see on the slide, is age 18. And here, I'm going to turn over to Dave, and he's going to talk a little bit about that.
Yeah, unmute would be good. So yeah, the mean age of depression is 18, and it's incredibly interesting how I actually thought it was a little bit younger. But I realized that 18 is really the mean age. And what's super interesting, and again, this is from the research, is that the mean age has gone up. And this sort of dovetails with some of the data that Afsana had presented earlier on. We saw the cases of depression rising in our teens for sure, but we're also seeing the mean age increase, I think, as a byproduct. So in the top line, we see the ages of 12 to 17 and that mean age going up year by year. And then the second is the 18 to 25-year-old group also going up over that 4-year period. And again, this is pre-pandemic. And so we knew, and just especially in 2019, we were watching and seeing rates go up and up. And so it's really no surprise. So yeah, the mean age is 18. Cool. Well, with that, I'm going to turn it over to Selena to think about symptoms of depression. So Selena, take it away.
Okay. So I guess, it's interesting. At first, I think going back to Afsana's, presentation earlier, right from the get-go, I noticed that, the MindWise group tie in anxiety and depression as well, along with eating disorder. And I think eating disorder is also something that's pretty prevalent now in a lot of our youth. And I think, definitely correlates with depression and anxiety a lot. So sticking with symptoms, what are some of the telltale signs that you guys may be familiar with linking to depression. It may correlate with anxiety too. Can you guys pop some into the chat and just kind of see, you know, how it compares to what the clinical, you know, like criterias are? Can the group pop in some symptoms that you believe correlates or that reflects depression? Isolation, great. Anything else that, you know, when you think of anger, good one. Any other ones when you know, assume someone is depressed? Lack of interest, yep, for sure. Good, you're like right on target. Those are actually a few of the ones that definitely fit into the clinical criteria. So sleeping a lot, yep. Any more? Okay, so Dave, you wanna move on down? So from a clinical perspective, tiredness without reason, yes, you definitely will hear that a lot. So from a clinical perspective, often as clinicians, when we are doing the so-called PHQ-9, we do ask people using the screen, here's the source for the step. Oh, sorry, I'm reading the chat. So persistent sadness in youth and kids, I think you will see maybe sometimes you just see that they have downcast face. Younger kids may cry for no reason. You also may see even teens. Actually, I have teens that have told me that they would like hide in their room and sob for hours. But is that obvious? It may not be. But, you know, because they don't want to feel embarrassed or anything. But, or if you have good connection with your teens, sometimes they may just tell you, hey, mom or dad, I just feel really sad and I don't know why. Some kids or youth may also say, or you may even, you know, witness, not just actually as I say this is actually for general for all people of all ages. You see sleep patterns changes. Some people do not sleep, some people oversleep. You also mentioned loss of interest. So some people may also stop doing things that they really like at one time. Changes in appetite. Some eat a lot, some may just stop eating. And I think this is where it may get kind of tricky too in terms of like eating disorder. Are they struggling with self-image or are they depressed? So these are some of the things that is all kind of not easy to tease out, right? Fatigue, someone mentioned, difficulty concentration. That's the big one with our kids, especially in youth. They will tell you that I can't concentrate. I don't want to do this homework. I just can't think. Or they start to feel like they're not good enough. They feel guilty for not, you know, having enough friends, they feel guilty for not being good enough. And then sort of like one thing leads to another, they start to say, hey, you know what? Because like Jessica was saying earlier, some of them starts to see that they get excluded, or some of them just compare and feel like, well, I'm not good enough. I'm not going to go to things. And you also will see irritability, like, you know, if you have a kid that usually is happy-go-lucky or more docile and more of like, I was gonna say not people-pleasing, but just more jovial, and then also they start to change and they get irritated. They you know, they are angry. They don't want to talk to you, or they lose patience. Those are all some of the signs to kind of pay attention to. Some kids, and actually in many of my teens that I have worked with, both in school and private practice, when I asked the question, have you ever had thoughts of wanting to disappear or wanting to hurt yourself or wanting to just, harm yourself. Often they would say yes, at least for one time. And is definitely alarming. And that's when, as a clinician and as parents, I think warrants for us to really like dig deeper and talk about what does that mean, and when you say that, how are you going to do it? Do you have a time? Do you have a plan? And why they would want to disappear, some of these things. So that's what we do as clinicians when we sit with clients, when we talk actually with my friends' kids. I'm not a clinician to them. I'm like an auntie or, just an adult friend to them. And sometimes I would just get into conversations with them about some of these things. And I am surprised that when you ask them, they do open up and they engage with you to talk a little bit about some of these symptoms that they do experience. So, Dave, you want to go on to the next one? So these are some of the ones that we may not necessarily like hear it with, like, put it into so much of a clinical term. So, and we may not necessarily give it second thoughts. And I'm telling you these not to make you feel like, alarming or anxious to go, oh my gosh, does my kid have depression now? I think these are some of the signs that can also show up and can be associated with, signs of onset of depression. So with little kids, when I work with elementary school kids, a lot of the times they would say, mommy, daddy, or a teacher, I have stomach aches, I have headaches. Now, just that by itself does not quantify them having depression. But if they persistently saying it, I think is a telltale sign for you to kind of think about, is there something going on at school or with their relationships that's causing them stress and anxiety? And if it is persistent up to like 2 months to 6 months duration and it still doesn't go away, and with you talking to them and helping them, I think you may want to talk to a doctor or someone about it. Perfectionism. So that is actually very, very, very prevalent right now. When I was at school base, I often work with kids that cannot make mistakes. And they feel so guilty and so guilt-ridden and a lot of negative judgment toward themselves when they don't get things in just the right way. And again, this ties into our latter part of our discussion about anxiety, but prolonged thoughts like that will start to wear down your child and your youth. And one of my current client is exactly that. And while for a while there, I've been treating anxiety, I started to realize the perfectionistic tendency is causing a lot of disruptions to this client's life, leading the person to not be able to achieve the simple tasks like homework or like sometimes to get up. So then when I ask, what is the narrative that you're telling yourself? It's like, oh, I'm no good. I'm disappointing my parents. I'm worthless, kind of things. And imagine you're a young one or anybody walking around daily, right? Having these thoughts saying, oh my gosh, I suck. I just can't get this. And I'm just not good enough. Imagine you yourself saying this at your job or to your spouses every single moment. How would that make them feel? They probably get annoyed at you. At work, people kind of tell you, hey, get your act together, right? And those are sort of the feedback loop for you, and more so put you into a place that you may feel less than, and also gets you to feel down about yourself. Regression. In kids, a lot of the times you may have seen that at one point they mastered something and they were doing really good at it, and you start to see like there are some changes, like they all of a sudden cannot do the task anymore, and you're like, hey, what's going on? You were doing this great a month ago, and now you can't do it, or you don't want to do it. That may also be a sign to tell that something is up. Is may definitely tie in. It may not be the physical skill set. It may be their emotional needs is being affected, and they no longer have that drive, the motivation to do so. And all this, of course, all the three that I just talked about will tie into academic decline. And in adults, it would tie into their production, right? Productivities. And when we're not able to produce, we start to disappoint. Obviously, that's going to lead to depression. So next one, please, Dave. So what are some of the causes of depression? I'm just going to go in and talk about some of the causes. So some of the, Dave, go ahead and move it. So some of the common causes of depression definitely tie into biological factors. So what are biological factors? They are factors that are kind of tying to our nature, like your foundation of your physical build, your cognitive abilities, your appearance, like some of those things, right? Like even nutrition is a big foundation toward your biological factors, like someone that grew up in a more privileged setting versus someone who grew up in a, more less than. That will affect the developmental of a person. Genetic factors, so family histories of having mental illness definitely has correlation and links into the next generation or every other generations, depending what the mental illness is. That could, so in depression, there are definitely genetic links to it. Stress. So I'm kind of highlighting some, I'm not mentioning every single one, but I think the other ones, make sense for the most part. Stress in the Bay Area, our lifestyle here is definitely hectic, right? You see how people drive, you see our schedule. For many of the parents, a big part of your job is being the Uber driver for your kids, or just for their events and dealing with traffic. And I think going back to the pandemic, a lot of the kids has shared with me, a lot of their stress factors is the fact that they do not know, it's not that they do not know how to use the technology, but it's the fact that learning through the technology, and imagine little kids, the elementary school kids, like kindergarteners. So during the pandemic, if they are to learn, imagine, I know that a lot of the younger generations know how to swipe, but using the computer and getting in and poking through to get into the different apps and trying to meet your teacher, these are all very foreign. And kids is all about connections, like why attachment theory, right? It's about skin on skin contact, connections. So even though we have the sophistication of connecting through Zoom, is not the same, right? You're seeing me through the screen, and it definitely is not the same in person. When I was doing therapy on Zoom with kids, I always have to prepare to be more animated on the doing therapy. Why? Because I have to work doubly hard to engage them, to capture their attention. They don't naturally have that. So kids will feel stressed if they're hearing you getting reprimanded, just screaming across the screen, going, "Hey, Johnny, what are you doing? Why are you not listening to me?" And the kid's like, "Oh my gosh," it's like, who is this person screaming at me? So those are some of the things that I think I personally experienced when I went back to doing school-based therapy. Some of the parents and some of the kids were telling me, I had kids that told me that they learned nothing. They didn't learn how to read, even though with all the good intentions and efforts the teacher taught them through the screen, they were not connecting. And when they came back to school, this was a 5th grader that told me that he was stressed coming in, and I saw it in his face. He was a kid that was taller than me, and he was this big guy of depression, and he just lacked facial expression, lacked emotions. And it was through the person to person, one-on-one, that he slowly disclosed that he felt really stressed going online to school. He felt stressed coming to school. So so those are some of the impact. And then hormonal changes. Guess what? We all have that. We start that when we go through puberty, and hormonal changes definitely gets us into that mood swing, or generally it's mood swing up, right? I think teenagers, they're drama, they're energetic. Parents will be like, "Oh my gosh, we don't get them." And then as we age, our hormones start to trail down. And interestingly, for women, certain hormones go down, for men too. And that's when anxiety and depression start to come up again. So puberty will kind of like angst up hormones that can easily correlate to anxiety, depression. And as we age, that's also the same. Let's see. And then social isolation. You guys mentioned that earlier. So just as Jessica said, social isolation, with teens, that happens quite a bit with social media. Before social media, I think where you can be a little bit more obvious in terms of the isolation, right? It's like you see people walk away from you. But with nowadays, the social media, the isolation is definitely more covert, in the sense that is not, well, at least for my generation. I mean, I'm not always on the screen, but for the kids, they will probably able to see it. And social isolation is also highly correlated with elderly. And that is why we also find depression often pretty prevalent in the older generation and elderly. So if you are in that sandwich generation and you have parents that are living overseas, or parents that have moved from overseas and they lack the communication skills and they're isolated from their friends, you can start to see some of their affect, their facial expression, just even their sense of self will kind of go down a little bit. Currently at my work, I have elderly that tells me "Oh, I don't want to be a burden to my kids, but I don't know the language." So with long term of that isolation, they start to feel downcast and they start to feel sad because they feel like they have no connections. So Dave, next slide. So other causes of depression, seasonal changes. So I lived in Seattle for about 6 years in the early 2000s, around that time. And one of the things that was all before all the Californians started moving up there or moving away. And when I moved up there, one of the things that I met fellow Californians was they'll be like, how do you deal with this, you know, like seasonal affect disorder? And for me, luckily, I didn't have that. I love the outdoors. So during the really dreary time, I'll tell you, I don't think how I cope with the seasonal changes was I drank a lot of coffee, just like what Jessica said about the teens. So Starbucks wasn't that famous yet. So I hit a lot of Starbucks, and that was how I coped. I mean, yeah. Chronic pain. Interestingly, chronic pain can be a culprit toward depression. And I have a story to tell. One of my friends, this is actually a friend from Seattle. He was a very successful pharmacist and, you know, good looking, was in his prime, doing great, like, but he had a skiing accident and broke his back. Sana, broke his back and has surgery. Consequently, post-surgery, he did recover, but he wasn't the same because he started having chronic pain, and it definitely prolonged, and it was enough to what's the word that I disable him from working full-time, holding his full-time job as a pharmacist, because he couldn't withstand the long hours of standing nor sitting. So he gave up his license, and he actually withdrew. He went into social isolation, and gradually I just started seeing the irritability. I just started to see the anger, and we didn't think anything of it. But after back then, I was not a clinician, so I remember kind of challenging him, going, "What is wrong with you? You know, you're like so different." And he would be angry. And then about a year or two later, I think he finally admitted that he was struggling with clinical depression. And he kind of stayed away from all the people group, like all friends group. And I had to learn to just kind of respect and meet him at where he's at. And, you know, it took him some time, and finally he did slowly come back out. He started dealing with his depression, and he came back and started working again as a teacher. But my point of sharing that story is because, you know, you see someone who is at one time such a successful, you know, able body, and you wouldn't suspect that he had anything clinical, like, you know, mental related, right? Depression, we wouldn't think that he would ever get that. But it is the challenge of the pain, and he was constantly in pain, that it really, really agitated him. And because people didn't know, and it wasn't until people started asking that and just started being there to be there for him, that he started, you know, getting some help, talking about it. And then so yeah, is I was gonna say, it's not an easy thing to just like point out to see depression, I would have to say. And then lastly, changes in aging synthesis. So okay, so I think I'm gonna pause there. Lastly, the changes in aging, I think I kind of covered that quite a bit. So I'm gonna move on and give it back to,
Okay.
Thanks, Nina. I'm going to pan up to Jessica now.
Yeah. So as we can, you know, as we all know, social media has been a huge factor in all of our lives. And who doesn't have a smartphone nowadays, right? And who doesn't have at least one social media account? And let alone if you ask the teens, preteens, even younger age kids, they all own at least one social media account. And so I think it's very important that we do kind of understand what it does to what kind of role does it play in our kids' lives. But one thing I would like to kind of mention here is when you do have a conversation, if there's any concern that you have with your teens, your children, about social media, their usage, and you would like to sit down and have a talk with your kids, one thing I would advise is make sure you mention that you understand, you see the both sides of whether the benefits as well as the harm. Why do I say that? In our practice, I often hear from our clients, and as well as my own kids, that they see and they complain that adults, parents often only see the bad side of social media. And the word they like to use is that we tend to demonize social media. But in their eyes, that's not so, right? So I think if you want to kind of being able to have that open channel of conversation, you would need to make sure you let them see that, hey, I understand the benefits of social media. And so for them to lessen that defensiveness, so for that you would like to have that conversation. So it gets you the open door if you mention the benefits. So on the next slide, that you can see, there are definitely many benefits as well about social media, and I'll mention a few here. So on one of the articles titled "Social Media and Mental Health," which I can put a link in the chat later. So this is a research article. 7 out of 10 adolescent girls of color have reported they have encountered positive, or even identify identity affirming content that related to race that they found on these social media platforms. And 71% felt that they have a place to show their creative side, right? And definitely more like people find that it's a safe space to self-express, right? They have, and social media made it easier to maintain friendships online. And also there's a huge high percentage say that they do find connections with people who are similar to their identity, whether it's the interest, abilities. So definitely there's great benefits of social media. So I think if you can kind of help your kids to see that, hey, I recognize there are good things about social media, and I understand why you go to social media, why you spend that time on social media. And I think hopefully they kind of lessen the defensiveness and able to hear you out, and hear you out about what your concerns are for them. And I don't have to go too much into detail and talk about what are the potential harms, which I think most of you, if you are parents, you already know what they are. But definitely, I think it's an important discussion that you would need to have, sit-down discussion that you would need to have with your kids about the social media. Besides the few bullet points here, there's definitely a lot more that you already know, because social media does increase the risk of anxiety and depression, which that can lead to a lot of unsafe, Selena have talked about a little bit earlier, some of these unsafe, unhealthy behaviors if they're left untreated. So at this point, I'm going to turn it back to Dave and talk about anxiety.
Thanks, Jessica. And listen, all the social media stuff, I think, really draws from the Surgeon General's report that you may or may not have seen that came out this past year. So I think what we can do is maybe, I think Jessica, I think you might have it. If you can push it,
I'll post it in the chat.
that'd be awesome.
Yeah.
Yeah, it's a really great, I think it's like 23 pages. It's really interesting to see. So I'm really short on time, and I apologize, but I am going to try to get through anxiety as quick as possible. So just like we asked about depression, what's the mean age of depression? What's the mean age of onset of anxiety? And as much as I want to poll you, I'm just going to give it to you. It's 6. 6 is the mean age. This was way younger than I had expected. But it actually makes sense when I think about the clients that are coming through. It does really fall around that age group, 6. And what's interesting is I think we oftentimes, when we think about anxiety in our teens or in our children, we do think about it in ways like maybe what we're familiar with as adults, but it does sort of come out a little bit different. And there's also different kinds of anxiety as well. We think about anxiety like you're afraid of something, but there's like, just think about the myriad of different types. Social anxiety, you've got test anxiety, there are phobias, you have I'm blanking out on a lot of them, but there are a lot of anxiety disorders. I also want to mention that anxiety does have a place where it's beneficial, right? We have anxiety because it helps us be focused at our best. Like, even before any presentation and even before coming to you guys, I still had a little measure of anxiety because my leg was shaking. But that anxiety kind of helps me to kind of be on my best as I'm presenting to you all. And that there is a place for it. And oftentimes if you play sports, when you hear about the zone, that's actually a form of anxiety where you're actually hyper-focused and you're actually able to perform at your best, but that's partly because of the anxiety that you're feeling. With that being said, the bad anxiety is the anxiety that, like Celine had mentioned, persists for a long period of time, at least 6 months, and it impacts a certain area of your life. So for our teens or for our youth or children, it might be their school, it might be their social life, it might be their behavior, which is, we're going to get to in a second about, what you might see. With that being said, what are the symptoms of anxiety? And there's a lot of symptoms. I broke this down between like the thoughts that people have, the feelings, and the behaviors. And some of them are pretty obvious, but some of them, again, are not as obvious. So like thinking, the way you think, so difficulty with concentration. And this is where depression and anxiety really go hand in hand. And so the difficulty with concentration can actually, well, I should say, I get a lot of referrals. My child has ADHD. And I'm like, okay, yeah, they're having trouble focusing. Let's come in, do an evaluation. And then come to realize, wait a second, it's actually more of an anxiety issue that they're having that's causing them to have difficulty with concentration and focusing. And so that's where clinically we treat the anxiety first before we even try to go down the route of treating if there is any ADHD, or at least evaluating. All right. Helplessness and powerlessness. I see this all the time where children and teens are like, I can't do this. I can't do it. Part of what they're saying is like I'm really anxious. And this is something that actually is true for my daughter, who's 13. And oftentimes, like, I'm trying to push her out there to actually have a courageous experience. And her response is, I can't do this. But her anxiety is really like sky high. And it's actually, so hers is actually a form of social anxiety. So actually the other night, I'm like in the restaurant with her and she drops her fork on the floor. And I was like, go ask the server for a fork. And she's like, no way, I can't do that. And I'm like, you're just asking them for a fork. But that feeling of powerlessness is like palpable for her. Some of the feelings that you see here that I think I'll highlight: shortness of breath, rapid heart rate. So again, those are very common for anxiety. Stomach aches, pains, gastrointestinal distress. This one is way more common than I've realized, and I hear it as, I got butterflies in my stomach. Or if they're getting ready for a presentation, I really need to use the bathroom and I need to go now. So what's interesting is we all know about serotonin and how we have serotonin in our brain. We know that it's between the neurotransmitters. And so like we use these serotonin reuptake inhibitors to keep the serotonin levels there. But what's really interesting is there's actually just as much serotonin in our gut, if not more, than in our brain. So that's why the gut is actually a really sensitive area of our body when it comes to anxiety. And then we have headaches and dizziness that can occur. And then in terms of behavior, there's sleep issues, a lot of arguing, irritability, and perfectionism. And you see a lot of these again, like in depression, and you see the similar ones that are like, oh, it's kind of interesting in anxiety. And the perfectionism, I actually want to just kind of dovetail with what Selena had talked about, which is it is really prevalent in the schools that we see today. And so a lot of the high schoolers that we're seeing, there's so much anxiety about getting a B. And I'll share this with one of my clients I had. She was 13 when I started seeing her, all about anxiety. Saw her through freshman year, and then that was okay. Sophomore year, things started getting tougher. And by the end of sophomore year, she actually got her first B. And that was completely devastating for her. It just rocked her world. And what ended up happening was the anxiety then turned into the depression. And mom comes home one day from work and her daughter hung herself with the sheets out the window. And luckily she came home in time, like when she came home. But that was how bad that perfectionism was for her. And it was life ending for her. And I'm telling you, like, that is just incredibly prevalent in our area, in our society. And so I have to speak about it. I have to really share about that. I'm gonna move on. So are anxiety symptoms consistent, like for each kid? And the answer is no, they're not. They're like master shapeshifters. And so what you like right when you think you've got anxiety kind of managed, it changes. And I use the example with my kids, the clients I see of the Little Mermaid, Ursula, and she's like big mean octopus or squid. Actually, I can't remember which one she is, but then she shifts herself into human being with Ariel's voice, and then eventually she shifts back. But I mean, what I'm really trying to get across here is like the anxiety doesn't necessarily stay the same. And if you think it will, and you think you got the hang of it or you dealt with it, it can transition to something else. So one of my parents that I've worked with whose child has anxiety, they initially had anxiety over social anxiety in the schools. And then once they got that down, then she had anxiety in the nighttime trying to sleep. And then once she got that down, it was GI distress from anxiety. So what I'm trying to say is it can change. And so be ready to address multiple issues of anxiety or different types of anxiety that come up. It's not going to be the same one all the time. So with that being said, what if anxiety disorder goes untreated? And the main problem is that anxiety is really a gateway disorder. And then originally the gateway disorder was about drugs and substance use. And maybe 30 years ago, it was like smoking is the gateway drug to marijuana or cocaine or LSD. And in this particular case, anxiety, which is actually very common, is really a gateway disorder to many other things like depression, self-harm, suicide, eating disorders. Like these are things that can come in after the anxiety has taken hold of the child or the teen. And so what ends up making it worse is it's not just anxiety alone. Now it's anxiety plus depression, or anxiety plus depression plus eating disorders. And that really becomes so much more complicated to manage, to handle. And, you know, what I tell parents is if you see something like anxiety, it's actually better you just take the time right there to try to get the treatment and get it under control, because if it prolongs, it can get way more complicated and way more expensive. So with that being said, how difficult is it to treat anxiety? Actually, anxiety is one of the most treatable symptoms and syndromes that we have out there. And we have good therapeutic options. So CBT is really helpful. Both Selena and Jessica use different play therapy or art therapy to help understand like what's going on the unconscious. And I do need to say, like, medications are very effective, along with tools like breathing, mindfulness, stuff we're going to be talking about. And the one thing I'll say about medication, which normally you kind of have a psychiatrist involved, is if you do the medication route, I would really emphasize that you have the psychiatrist and the therapist really collaborate well together, because that's going to bring the best outcome that you can find when it comes to treating anxiety and depression. So make sure that they're ready and willing to talk with one another. That has been so helpful with many of the clients that I've worked with who need medication. And the last question, number 11, is what role do parents play in anxiety? And the reason I'm sort of landing on this one is because, we as parents, we oftentimes think, well, yeah, they got anxiety or they got depression, but we do play a role. And I say this because I might say it might be a little bit controversial, but sometimes we find it easier to take away the triggers or the stress that's causing the anxiety because it's easier than to really have the teen or the youth really struggle with it. The example I'm going to give is more of a child, but this particular child had a trauma from an automobile accident and didn't want to go on highways or fast roads. And every time that they would be going, I think, above 30, 35 miles an hour, they would begin to get anxious. So the parents stopped driving on any major roads and would take all local. But sometimes to get from point A to point B would take twice as long because they're taking all these local roads. That's an example of parent accommodation that ultimately is really not helpful for the child. And in order for them to really feel like they're taking ownership of their health, especially on the teens, it's about teaching them how to manage the anxiety. And I understand as parents, it's not the easiest thing to do because oftentimes teens don't want to listen. I have my teens, they don't want to listen to me. But that is also where sometimes the therapy can really come in and help and be a collaborator in terms of helping your children learn how to deal with the anxiety that's coming up for them. Okay, so in my last few minutes, and I'm so sorry, I want to give you a couple tools to think of to use in the future. Screening is really important, and I can't stress this anymore. So screening for depression, screening for anxiety. For anxiety, we use the GAD-7 here, and you can Google it. And it's 7 simple questions. If you're dealing with teens, they can totally do this on their own. If you're doing with children, I might do it with them. This is the PHQ-9, the Patient Health Questionnaire. Again, really straightforward, easy to do. Screening is what we need to do in order to like have our radar go up and go like, hey, something's going on here. We should get them some help, okay? When it comes to anxiety, we actually have this scale, it's called subjective units of distress, that you can use actually daily. And you can have them point or have them mark themselves where they are on this subjective units of distress scale. Tie it in, well, actually I should say, I tie this in with my therapy because usually I can then use the subjective units of distress and help figure out what's causing the distress, but then also what are they doing to bring the subjective units of distress down, right? So there's a way to analyze that and make it actually really useful and helpful for the youth. And then finally, and I want to do a 5-finger breathing, but I don't think we have time, but there are ways to help manage anxiety like deep breathing, mindfulness, and imagery. Actually, there's some really great apps out there that can do this and are really helpful to guide you through some deep breathing or mindfulness exercises. But it's extremely useful to manage anxiety because, well, frankly, anxiety is really you feel the physical reactions of the anxiety, like the shortness of breath and the rapid breathing. The breathing exercises actually will counter all the physical manifestations of anxiety. Okay. And then the 2 ways that I think could be helpful for you is really what MindWise presents, which I think is really important. Like education is key. Having the mental health fluency is going to help better understand what's going on and better actually understand how to help them. And then the other way is really what I want to offer to all of you, which is 15-minute consultations, because I think sometimes there's things that you may want to talk about that, it's A, we're out of time, B, it may be too personal to talk in a large group. So I'm going to actually give Afsana a link later on that she can push out to you to schedule a 15-minute consultation with one of us at Peninsula Wellness. And that's my presentation. Thank you all.
Thank you so much, David, Jessica, and Selena. I'm going to hand over to Sheena now. And we are running a touch late, but if folks can stick around with us a little bit longer, especially if you have questions, that would be awesome. If you do have to leave, no worries. I'll make sure to share the recording with you. And we thank you for joining us. So Sheena, I will hand it over to you if you want to present some resources.
Thank you all. I'm just gonna go over, and here we are. So part of what we're offering here in MindWise is a support system. And as David, Jessica, and Selena outlined, the nature of depression and anxiety morphs and changes so much. So it takes so many resources to handle it. And I want to highlight the fact that you always need a clinician to guide you in the process, but there are tons of resources available to support you in the journey. And I'm going to just go through some briefly. We will be providing them on the Facebook page, and Afsana will be sending out links as well to everybody. So what I found really useful was the American Academy of Child and Adolescent Psychiatry and their page, particularly the website. It has amazing resources for parents, teens themselves to access, as well as for clinicians. And the links are exhaustive. They could start from books to PDFs to videos and apps, which I'm going to cover a little bit later. But this is just a one-stop shop for as many resources as possible. And I really advise people to have a quick look there. And this can actually start the journey if you're just looking for even clinicians or where to start with. The second one I found that was really interesting was also California offers a lot of human health services. And there's a specific page for mental health resources for youth. And I think this is also a starting point, and a lot of the services are free of charge. So this is great to access if you need it. The National Alliance on Mental Illness also offers various free services and low-cost services. And also local county services can be offered at a low or no charge, depending on the area you're located in. As for the apps, we were talking earlier about how technology can be useful, and I think Jessica highlighted some of those. These are those apps that are available right now that I went through personally, and they aimed at ages as low as 4, starting at 4 years old. So I know many people are familiar with BetterHelp, and this is both for depression and anxiety. But as I mentioned earlier, the apps, except for BetterHelp, which is clinician-based, but I think a comprehensive assessment and treatment from a trained mental health professional is key. And I think these are supportive. The Johns Hopkins University School of Medicine has a great one, and this is adolescent depression. And it's a program that they use. And a lot of this is educative for both the parent and the teen. So this is a great one to access. And Mind Tools, this is really interesting because it has a thought diary, activities, safety plan. There are even tests available on the app themselves. And this is available on the iPhone free of charge, as well as through Google. And these are specifically for anxiety. Calm is obviously known by quite a few people, and I think clinicians and all of us use them in different capacities. Worry Time and Worry Tree, I thought were particularly helpful in terms of going through the decision-making around a stressful event or anxiety per se. I see a lot of nods, so people are familiar there. And Breathe is the other. So these are some quick apps that you can source, and we'll still be posting them on our page, as Afsana mentioned, on Facebook. So we're going to have questions hosted there. We're going to have all these wonderful resources, and it's to create a community for all of us to access at any point in time. And David, Jessica, Selena, all of us will be present, as well as Leanne. So please feel free to use these resources, and they'll be constantly updated as we go forward. And as I said, and as David highlighted, suicide's always something to be mindful of. And so we have a suicide and crisis lifeline at 988, which I don't think many people are aware of, but obviously 911 is always there. So I hope you avail yourself to some of these, and please feel free to reach out to us. And we'll be offering all our services on the page, and Afsana will be sending out those links. Thank you.
Thank you so much, Sheena. Yes, we will send them out in a follow-up email as well as on the Facebook community page. Thank you to those who stayed. I'm going to stop the recording now, and